my screen. Boom, boom, boom. Okay. Muscles, muscles, muscles. Skeletal muscles, right? The kind of muscles that attach to bone. Yeah. With what do muscles attach to bone, Miss Hunter? Miss Hunter, what attaches muscle to bone?
What attaches muscle to bone?
Yeah. Glue? Rope?
Fascia?
Fascia. Yes, that, by the way, is 100% correct. This particular fascia comes in a certain shape and fiber direction, things like that, and we give it a name. But it is fascia. You're 100% correct.
It's not ligament or tendon, right? It's not ligament or a tendon? Or is it? Okay. It is. 1 second.
I love her so much.
I think it's tendon.
I think you're right. Thank you.
Yes.
You were too close to give you any feedback. I wanted you to just kind of, yeah, it's tendon.
Okay.
Tendon attaches muscle to bone, and tendon is fascia. Very much so.
Okay.
Very much so. What does ligament do, by the way, since you mentioned it?
I believe that's bone to bone.
That is, you believe correctly. Thank you. All right, we're off to a good start. Miss Hunter has knocked it out of the park here. We are good. Miss Bilotic, what attaches muscle to bone?
Tendon.
You're exactly right. Thank you very much. Miss Torres, what attaches muscle to bone?
Tendon.
Go.
Sorry.
It's okay. I know it's hard when you're in a hammock, you know.
No, it's not because of that. It's because my phone.
I'm just giving you a hard time. It's okay. It's all right. You probably had to take the pina colada out of one hand and pick up the phone with the other hand. Get the straw out of your mouth and respond. It takes a while.
Yeah,
I got it.
It's kind of hard though. Yeah. I
Just
have to practice more.
hand the pina colada to the cabana boy who's fanning you, and then grab the phone. Okay,
Yeah,
cool.
but then he's also giving me grapes.
Oh
That's
yeah,
kinda hard.
that's true. And he's got to peel them first. That's true. Okay, entiendo. All right, Miss Felix Osuna. What attaches muscle to bone?
That's tendon.
Thank you. Cool. All right. Welcome, everybody, to Muscular Anatomy Boot Camp. This is not the entire Muscular Anatomy Boot Camp. This is a course that I actually teach massage therapists after they've graduated because they all forget their anatomy if they ever learned it in other schools, so they come to us for that. But this is a portion of that course that I'm using to help you review the muscles that you have learned so far. Yay! This is the most important stuff in the course. The skeletal muscles are the most important stuff in the course. Where they are, how to find them, how to palpate them, how to massage them, how to stretch them, what actions they perform, origins, insertions, or attachments, all that stuff.
I have a question.
Yes, question away, Miss Monreal.
Just before I forget. So what is the fascia called? The webby part that actually attaches it to the bone? What is that called?
Well, you mean the fascia that's wrapped around the bone?
So is it the periosteum?
Periosteum is around the bone.
That's
Yep.
what it is?
The tendon weaves into the periosteum.
Okay.
And by the way, in the real world, I mean, in my mind, Miss Monreal, it's more like the fascia of the muscle. Think about this for a second. Hold on. This is a really, can you see the whiteboard?
Yes.
Okay. I honestly believe what I'm telling you, okay? So it's not just a kind of, it's honestly a different way to think about it. We dissect the body up and sometimes that confuses things. And as a massage therapist, I love this question you're asking. So this black, I'm gonna be drawing fascia right now. Hold on, one more time, 1 second. Oh man. It's not my day. All right, hold on. So, all right, hold on.
Is that the striated muscle?
Yeah, it's going to be the striated skeletal muscle. All right. I argue that everything you're looking at right now is fascia. Everything. And fascia is kind of like rebar and concrete. That's not, and it's also like, be like if you put rebar and really strong bungee cords inside concrete. And you'd have to have special concrete, by the way, that's kind of like Jello, so it could flex too. But you'd have this really strong adobe kind of flexing stuff. And honestly, like when you break a bone, what grows back first is the fascia. And then it fills in with calcium and potassium. Then the concrete part gets filled in. But the fascia grows back first. The fascia is through the bone. This is why bones have a little bit of flex and they're so strong. Like when you pour a big concrete slab, it's not just concrete. You have to have metal inside it or it's not that strong actually. So what really happens is the fascia with your muscle, all this is fascia. Your body fills this part in with long muscle fiber cells that are called muscle cells, muscle fibers with little sarcomeres in them that go but they're inside the fascia, and this stuff is actually really tender. The muscle itself is really tender. The fascia is protecting it, and it allows this part of this fascia to get pulled together. Your body fills in this part with calcium and potassium, and it makes this really hard bone. And all of this is the same fascia, but when it comes off here, we call this part a tendon. We call this part the periosteum, but it's the same fascia. It never stopped. And that same fascia is in this muscle here. Over here, by the way, we've got the other part. So people think the way we teach it to you, though, I don't like. What we teach you is like, hey, there's a muscle here, and then there's this whole magical part that comes right off the end. That's a tendon. And then there's a bone over here, and that bone is right here, and it's wrapped with something different called a periosteum. That's not really true, right? So it's more like roads, like I-17 and Flagstaff might become a different name, like Road 386, but it's the same road. It just passed into Flagstaff, and we call it by a different name. This is all the same fascia. You're a giant fascial network. Connective tissue, which fascia is the most plentiful tissue in your body. Connective tissue is the most plentiful tissue in your body. And that
I have a comment. Did you see the Cowboys quarterback injury?
No.
No.
No, what happened?
I was gonna ask you about it because it came to my mind. Like, Jack, did he broke his bone, or it was the what was it? I didn't pay attention. I saw it. My son showed it to me, but I didn't follow to see what it was.
I'm the only guy that I know who doesn't watch football or basketball or hockey or soccer
Oh,
or
you don't watch sports?
pool
Oh.
or rugby or golf or badminton or ping pong or checkers or so can anybody tell us what injury this was?
It was an ankle injury.
Ankle injury. Oh, and so we don't know if he broke his ankle or if he tore ligaments. Yeah, I don't know that, Miss Torres.
About it the day it happened, and they weren't very detailed. It was a severe ankle injury.
Yeah.
Followed up.
Yeah. Most ankle.
His leg was hanging. His foot.
Yeah. Well, you don't have to break a bone for your foot to hang. Your foot could be hanging because he tore ligaments or tendons.
Oh, see, that's what I did. That's why I asked, because I didn't know. Maybe I thought you knew, so you could explain to us. Because
No.
that looks weird.
But I'll tell you, football players have lots of ankle and knee injuries because you have that powerful body on top of these legs, you know, and they're cutting laterally. And those lateral cuts put lots of side shear into the knees and ankles. And man, it's just, human bodies weren't really designed to be that size, to be very honest with you. Yeah. Anyway, I'm not saying it's bad. Oh, go ahead.
Have you ever been to any of like the fascial conferences that they put on?
No, I've not, but I read all sorts of fascial literature. I'm really into it. Yeah. But the reason I haven't been to the fascial conferences, the ones I've known about have been over in like Europe. I mean, they're international conferences, yeah. And they're really full of like, I feel like they're full of people way out of my league, to be very honest with you. They're full of doctors and people that have really, it's not such a massage therapist kind of thing. There are massage therapists who teach this, but the fascial conference seems to be another 3 levels above that. I feel like I'd be like, what? You know, I'd be back there going, it's kind of like concrete with rebar and rubber bands in it. And they'd be like, yeah.
Oh my god.
Okay. So thank you for that question, because I really do want you to think kind of about the fact that the whole body is this kind of thing. It's fascia everywhere, and some of the fascia is really hard, some of it's soft, some of it's in the middle, depending on what they fill it with. Some of it can contract. Your muscles are fascia that can contract because they have contractile tissue in the fascia. Instead of looking at it like a muscle attached to a bone, your spider webs are everywhere.
Well, I do like how you explained it, because I would have, or that's how I pictured it before, kind of how you said, like, there's the muscle, there's the tendon, there's the bone. So it's really neat to picture it all being one.
Yeah, it's neat for me too, because when I went to school, by the way, they taught us like that the body was just stacked on top of parts and stuff like that. And about 20 years into my profession, people started coming out and saying that's really not accurate at all. And it doesn't explain a lot of stuff. I'll throw out one other thing at you guys that I'm going to explain later, but I want to throw it out to you so you'll think about it. If you were just bones stacked on other bones, the amount of impact your knees and ankles and everything would take would destroy this in a month. Like, we can't really just work by just being stacked on top of ourselves and just pounding along. It doesn't make sense. And we're going to later learn that fascia actually helps us support our body in a very different manner than we were ever taught. We're not just stacked together like a brick wall or a building. We're much, much more complex than that. But I'm leaving you with that cliffhanger. Okay, so there are 640 muscles in the human body. Even if we only focus on the main ones, make sure you write all these down really quick. Okay, about done? Everybody got that? Good. I'm going to ask you to read them back to me in a second. Oh, get this page too. Did you get all those? Good. Okay. All right. Memorizing muscles is not a good way to go. There's too many to remember, and it's too hard to do. So what we want to do is move you away from memorization. We want to move you away from memorization. Now, that does not mean that there aren't certain things you have to memorize, but I want you to use your smarts when it comes to muscles too. So this is a body. You got this little body diagram here. This is a certain type of diagram. It's very interesting. This is a program that we fed all the muscles into, those 640 muscles in, and when words showed up more than other words, it made those words bigger. And when words showed up less than other words, it made those words smaller. So this is a chart. It's a graph, but it's like a pictograph. And so if you see the word flexor in there or longus, it means flexor and longus show up in a lot of the muscles we study. And if you see a really tiny word in there that I can't even read from here, it means that is only used once. And the point I'm trying to make here is learning what longus means or what flexor means, or a levator, or inferior, or minor, or rectus, or superior, or digiti, these big words in there, or posterior, helps you understand about a whole bunch of muscles at once. Yeah? Capitis. Yes. Capitis means it has something to do with your head, the thing you put a cap on. I just saw somebody type capitis. Yes. So what's cool about it is, with capitis, for example, is I might forget there's 640 muscles, right? We're going to learn about 135 in this class. I might forget one of those. I mean, I'm old. But when I hear capitis, I'm like, well, it's got to connect to the head. So I already know I'm probably dealing with a neck muscle. So at least when somebody comes in and you get these kind of clients, they'll come in and they'll be like, yeah, I'm a doctor, a physical therapist, or I'm just really smart and you're really stupid, and I've got this blah, 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 capitis, blah, 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 capitis, blah, blah. I go, okay, and I start working on their neck, and they're like, oh my God, you really know your anatomy. No, I don't. I don't even remember what muscle you're talking about, but I know it's back here somewhere because you said capitis, and then I can at least tell you, and I'll be very honest, I can at least, they'll be like, well, that's not exactly it, and I'll be like, well, of course that's not exactly it, sir. I'm working on the surrounding muscles too because they tie into that capitis fascia, which is me covering my butt because I don't remember the particular capitis muscle they're talking about, right? So I'm not telling you, I'm going to be very blunt, I'm not telling you to half-ass it, but I'm telling you that knowing this stuff can be really helpful, especially while you're churning through your head. Like maybe I do know where the splenius capitis is, but I don't know right away, right? There's 135 muscles in my brain. This way I hear capitis, I think neck. Going to the head, neck. So when they get on the table, I'm already working the neck, and now I can start to think semispinalis capitis or splenius capitis, or these are muscles you're going to learn later. And then I can start to remember where that thing is. So it's just, these are very helpful little tricks to use so that you're not just an encyclopedia, just kind of regurgitating muscles. So we're going to kind of use that today to talk about the muscles we've learned so far. You know, what are things we should know about? What are common trends we should know? We're also going to just look at pictures of the muscles that you've learned about and see if you can identify them. So I will be calling on you. And if you get them wrong, don't worry. It's just like all the other days. I'll just call on you 17 more times until you get it right. Because that's what I do. Yeah, and it's not meant to punish you. It's just meant to learn. It's just fun. So just laugh and move on. Okay. So how are muscles named? Muscles are usually named in Latin. By the way, there is one French one, I think. They're sometimes named by their size. So when something is like, later we're going to learn about your gluteal muscles that make up your bottom and your hips. And there is a gluteus maximus. That's size, right? They're sometimes named by their shape. You guys actually learned two muscles that I can think of right now. Oh, three muscles that I can think of right now that are named by shape. Can anybody give me an example of a muscle you learned named by shape?
Trapezius.
Trapezius. Why trapezius?
Does it look like a trapezius? Trapezoid?
Trapezoid. A trapezoid, everybody, is a pushed over square. So a trapezoid is that. Well, if you take that and you turn it, you've got a diamond. And a diamond is your trapezius. It's a trapezoid. That's exactly where it got the name from. Can we name another muscle that's named by its shape?
Serratus anterior.
Rhomboid.
Not serratus anterior.
Shape.
Shape. Still shape. You're okay. What was it, Mr. Gondaris?
Okay.
Rhomboids.
Rhomboids. Again, rhomboids. A rhomboid is a square that's pushed over two. So it makes sense too. And think how the rhomboids run. They kind of run like this. That's the rhomboids. They are shaped like a rhomboid. For $1 million, who can tell me the last one? That's named by its shape, believe it or not.
I'll tell you.
Who said that?
Me.
Me? Who's me?
Carrie Ann.
Oh, sorry. Sorry. Miss Hanson. Miss Hanson, why do you say deltoid? Where do you get that from? You're right, by the way.
Isn't it like triangle?
Yeah. A delta is an upside down triangle. Yeah. So the deltoid. And that's what your shoulder is, an upside down triangle. So it's named by shape. Very good. Some muscles are named by orientation of muscle fiber, which means the direction the fibers run. So later we're going to learn about rectus abdominis. Rectus means up and down, and these are abdominal muscles that run up and down. Some muscles are named by the mechanical action they do. The actual action they perform is in the name. Have we learned about a muscle that the actual action is in the name?
Levator,
Levator what?
scapula,
Yes. And what is the main action of the levator scapula?
to elevate the scapula.
Yes, and that's why it's called levator scapula. Thank you very much. Some muscles are named by the number of origins or heads in the muscle. Can we think of two muscles we've learned so far that are named by the number of heads that they have?
Tricep, bicep. I bet you, Jack.
That was fast.
Thank you both. You're both right. Seps, don't forget. Seps means heads. Seps means heads. Biceps means a two-headed muscle. Biceps brachii means two-headed muscle on the arm. So triceps means three-headed. Beautiful. Some muscles. Go ahead.
Oh, so seps means head, but capitis means head also?
Yeah.
Okay.
Yeah. You're going to have lots of that kind of stuff. You're right. Yeah. Sorry, just threw me for a second. Because you're making me think. Some muscles are named, I can actually only think of one off the top of my head, and you haven't exactly learned it, and we've talked about it. But some muscles are named by their origins and insertions. So they just tell you all the locations of the origins and insertions. Can anybody think of a muscle in the neck that we haven't really taken a test on, we've talked about, that's named by its origins and insertions?
Is it the sternocleidomastoid?
You mean the thing that has an origin of the sternum, the clavicle, the mastoid, and inserts in the mastoid process? Sternocleidomastoid? That's exactly what I mean. Sternocleidomastoid. It's got two attachments here and one here. Sternum, clavicle, sternocleidal, mastoid process. Sternocleidomastoid, SCM. Yes. It's named by its points of origin insertion. Some muscles are named by function, like what they do, which is not exactly action, although it's darn close. But for example, you've got your main chewing muscle here in your jaw is called your masseter, and it helps you masticate. Masticate is when you chew. I see the look on some of your faces. Thank you, Miss Beach. Yes, you're all masticators. So, and you're... Yeah, masticar. Yeah. A lot of these words will sound like Spanish words because Spanish is a Romance language, and Romance languages all derive from Latin. English is not a Romance language and does not derive from Latin. So a lot of my Spanish-speaking students actually do very well in this area because a lot of the words sound familiar. Masticar, yeah. But anyway, masticar, which in Spanish means to chew, and masticate, which in English means to chew, and this is your masseter. Don't worry about that particular muscle. I'm just trying to make the point that some muscles are named by function. And some muscles are named by location. So, like the location in the body. And let me just make sure I don't have another slide here. Yeah. And that can be, by the way, whether it's superior, inferior, anterior, posterior, or if it's in the abdominal region or in the lumbar region, right? Quadratus lumborum is a muscle that's in the lumbar region. Lumborum tells you it's in the lumbar region. So some things are named that way too. And by the way, many muscles are named by multiple things here, right? So can you tell me a muscle, there's two actually that we've learned about, that are named by the number of heads they have and their location?
Bicep femoris?
Well, but we haven't learned about bicep femoris yet.
I thought we did.
Yeah?
Yeah.
We're not really doing
I
thigh
think
muscle.
in the beginning of the
Oh,
talk.
Sure.
we
Okay.
went over that.
But anyway, you are right. Sorry, you are right. There's a biceps femoris. It's a two-headed muscle in the back of the leg, the femur region. Thank you. You're absolutely right. Two that we've learned about in this section.
Biceps brachii.
Yes, which means the two-headed muscle found in the brachial region, biceps brachii. That's why the regions that we taught you in the beginning of the class were so important. That's why the actions and all this other stuff is so important, because I don't memorize the stuff. I just memorize all these other parts. And so literally when you say to me biceps brachii, I go two-headed muscle brachial region, and then it's pretty easy for me to kind of remember that's the one in front, triceps is in back because it's bigger, that kind of stuff. But I'm not actually just straight memorizing. Cool. Love it. Okay. So this is not the last time you will hear this speech, by the way, because it's all about muscles, right? So we'll be doing this again. But I just want to kind of give you an overview of kind of how to go about thinking about muscles and how to apply it to our current ones, which we'll do more of here in a minute. So later we will learn about muscles named by size, by maximus or minimus or longus or brevis, or major and minor. Do we have muscles that are named by size right now that we've learned about? Yes, Miss Petrie, what were those muscles?
We have the,
You just drew a blank.
I know, the majors and minors, so the rhomboid major and minor.
Right, so they were named by size and what?
Are they size
Are-
and, how they're located?
Rhomboid is a shape actually, so size and shape.
Okay.
Yeah, so rhomboid's major and minor, and the minor actually is smaller, the major is bigger. And rhomboid is actually kind of a fallen over square, and they look kind of like a fallen over square. So not exactly, by the way, but the point is, yeah, very good. Shape, we already talked about the trapezius. We already talked about the delta for the deltoids. This one's very interesting. Serratus anterior, Miss Monreal, is a saw-toothed muscle found on the anterior of the body. When the serratus comes out from your sides here and attaches to the first 8 or 9 ribs, it looks like saw teeth. Serratus almost sounds like saw, serratus, right? And so it really does mean saw-toothed. Saw-toothed muscle. Serratus anterior is a saw-toothed muscle found in the front of the body. By the way, Miss Monreal, if there's a serratus anterior, is there a chance there's another serratus muscle?
Well, yes, there is.
Thank you. Yeah, you're guaranteed if they tell you superior, inferior, posterior, anterior, lateral, medial, that there is the opposite or something of it. Otherwise, they wouldn't put it in there. They wouldn't call me Tapscott Jr. if there wasn't a Tapscott Sr., right? It just, that's the way it works. So if there's a serratus anterior, you can bet later on in the next course, actually, that you'll be learning about a serratus posterior. 2 of them, actually, but that's a whole other story. Okay. Oh, flat, yes. Plat means flat. Platysma is a flat muscle. You have not learned about the platysma yet, but I can show you mine if you want. Okay. It is a flat muscle that actually inserts, you don't have to remember this, by the way, we're going to learn it later. It's a flat muscle that actually inserts under my skin. It's very superficial, it's very flat. From the bottom of my jaw down here, and it runs down and actually inserts in the upper pec fibers here. So this is it. It down this muscle here. That's a platysma. Makes you look like a lizard. That's your platysma. I know it's very attractive. Pay attention to the lesson. Okay. All right. So some muscles I said are described by orientation. We're going to later find out that all the abdominals are done this way. You've got the rectus abdominis, obliques, things like that. Don't worry about that yet. And mechanical action. Flexors, extenders, abductors, adductors, rotators, levators, depressors, pronators, supinators, tensors, sphincters. So, Miss Nguyen, don't worry, don't overthink it. Muscles can only do one thing. What is the one thing they can do?
Contract.
Yes! Thank you. Miss Yanez, muscles can only contract, so they can only pull, right? So, using that logic, where would I most likely find flexors in the body?
In the front.
You nailed a very hard question, thank you. Yes, because most of my flexions occur in front of my body, and muscles can only pull. If you want to pull me to the front, you've got to be in front of me. If you want to pull me to the front, you have to be in front of me. There's no magic, right? If you want to pull me back, you've got to be behind me. Well, if flexions happen in front, flexors have to be in front to pull me. So an anatomical position.
And it's the opposite for your legs, right?
It's opposite for what now?
Your legs, when you flex. Your
Yes,
legs go back,
that
right?
would be the one exception. Absolutely, you're absolutely right. But yes, but you answered the general concept, right? So like I have a whole bunch of forearm flexors, a lot of them. They're all found in the front because that's where I do my flexions, right? I've got hip flexors that we're going to learn about later. They're all found in front. Flexors would be found in front. Yes. Miss Monreal.
Yes.
Where would I most likely find extensors in my body?
On your back.
Yes, 100% true. On the back side of my body, right? Yeah, like my spinal erectors are extensors and they're found in back, yeah. But in general, when you hear about flexors are going to be in front, extensors are going to be in back. On your forearm, really quickly, just an example, there's a whole bunch of muscles here that operate my hands. And there's a whole bunch of muscles back here. 95% of them are called flexor something here. And there's like 10 of them. 95% in back are called extensor something. So instantly it leads you to that spot right away. Cool. Trickier question. Miss Cooper.
I always know when you're gonna call on me.
Yeah?
Psychic, like seriously.
Good. All right. I hope you're psychic about this answer. Can you show me, for one thing, an abduction of your shoulder, just to make sure you remember what an abduction is?
What would that be like?
Yes. Thank you. Abduction is moving out. Abduction of my leg is moving out. So everybody, this is important to this question. Abduction is here. Abduction is here.
So,
This guy doesn't do it, but abduction is out to the side. So it's this. All right. So where would I find abductor muscles in general on my body? Remember that flexors were found in front, extensors were found in back. Where would abductors be found if they have to pull stuff out to the side of my body?
what would it be medially?
Well, that's the middle of my body.
Laterally?
Yes, they would be found lateral. They'd be found on the outside of my body, right? Because they have to pull to the outside. Thank you. Mr. Kandaris.
Yeah.
where would adductors be found? The things that pull me back together.
Towards the midline and specifically your adductors, like on your inner thigh.
Yes, he nailed it. Your midline, specifically, like I've got your 5 inner thigh muscles, the muscles that rub together sometimes when you're walking, or maybe they don't. They do for me. The muscles between your legs, you've got 5 of them. They're all adductor muscles or hip adductor muscles. They're on the inside so they can pull my legs together. Yeah? So that's kind of cool. That's kind of cool. Levator muscles would have to be found on top of whatever they're levating, lifting up, right? Depressors would have to be found underneath, right? Miss Torres.
Yes.
This is a little trickier. What region of the body would I probably find pronators and supinators? What region of the body would I probably find pronators and supinators?
Well, in your palms?
Yeah, close enough. I'll take it. You're on the right track. The point is, I pronate and supinate here, so the pronators and supinators have to be somewhere around here. We're later going to find out they're in the forearm mostly, although the bicep is a supinator. But the point is they're down here because that's where the action occurs. That's what I was looking for. You're absolutely right. Cool. By the way, sphincters are round muscles that seal up. My mouth is a sphincter. Your butt is a sphincter. They're actually very similar. That's not an insult. They're basically the same kind of muscle. You actually have, by the way, a little anatomy interesting thing. You actually have 2 sphincters in your butt, and one is under your conscious control, and one is not as much under your conscious control. And the one that's under unconscious control keeps itself sealed when you're sleeping, so you don't poop yourself when you sleep, which is nice if you can avoid that. I have a better night's sleep. Yeah. Okay. What does bi mean, Miss Bilotic?
2,
Yes. What does tri mean, Miss Bilotic?
3,
Yes. What does quad mean, Miss Bilotic?
4,
Yes. What does seps mean, Miss Bilotic?
head.
Thank you, ma'am. Cool. So we've learned about bis and tris already. We will learn about more bis later, and we'll learn about quads later. We already learned about origin insertions, the sternocleidomastoid. We've already kind of talked about we'll talk about the sartorius later, don't worry about that. Okay. Okay. So, please do this with me. Right? Take your open hand, put it on your chest, and say, not on your chest like that, like this. Both.
I don't know why you're frozen.
Oh, well, give me a second. There you go. Say pectoralis major. You don't have to unmute.
Okay, I was like pectoralis major. I thought
Pectoralis
that's what
major.
they did before.
Switch to 3 fingers pointing down. Say pectoralis minor. Right? We're going to come back to this. Put 3 fingers going up like this. Kind of hard to get them there like this. And say deltoid. Deltoid has 3 parts. They all come together in this deltoid here. Take your hand underneath your arm and go zzz, 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 and say serratus anterior. Zzz, 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 zzz. Yes. Take your fingers, hit your arm twice. Biceps brachii and brachialis. It's a 2-headed muscle here, and there's another one underneath it. 2 reasons to use 2. Biceps brachii and the brachialis is underneath it. Biceps brachii and brachialis. Cool. And it's a good way to find a vein. Okay. 3 fingers, back of arm. Triceps. Triceps brachii. So we do this when we're training you, and I really recommend you do it when we're learning muscles. I see some people do it, some not. But touching you're trying to get input into your brain about this stuff. Making signs, touching these muscles, making symbols tends to make you learn them better. That's why we do this. So we're going to do that one more time, then we're going to move on. Pectoralis major, it's about this size. That's why we're doing it. Pectoralis minor, it's about this size. Remember, it attaches to ribs 3, 4, and 5. Deltoids, they have an anterior, middle, and posterior portion. Oh, trapezius, sometimes we do this for trapezius. I skipped it, sorry. Let's not forget the saw-like muscle, serratus anterior, biceps brachii and brachialis, triceps brachii. Cool. Thank you. Thank you for indulging me. What happened to the hammock, Miss Torres?
It's hot outside now.
Oh, gotcha. Okay.
I mean, I already got some vitamin C. That's all I need, so we're good.
Gotcha. Okay. All right. Good. We're skipping all this. Sorry, everybody. All right. So when I had you guys do your homework, one of the comments I made was, can I tell from your homework what muscle you're talking about? Could you draw it on a body if you followed your homework and in your origins and insertions or your attachments? I think it's easier if you do attachments, but Miss Felix Osuna, what muscle is this?
Is that the longissimus? Is it the one that we just learned last week?
It is. So what makes you think it's longissimus?
Well, because it's from the sacrum all the way to like, oh wait, it isn't, right? I must not the spinalis because it's not supposed to be a spine.
Do you hear her logic, everybody? She said, I know it's not the spinalis because it's not close to the spine. That's very good logic. It's not attached to the spinous processes, so it can't be the spinalis.
Mm-hmm. And then the longissimus is from the sacrum all the way to like the head, and it's until.
Good memory. Up to the mastoid process of the head. Yep. This muscle seems to attach into the transverse processes of the lower cervical and the transverse process, kind of the lumbar region. It sweeps out. It's from the hip, by the way. Interesting. Kind of the crest of the ilium. And it seems to grab onto all the ribs or the costals. What muscle do you think this might be?
I can remember the third one that we learned.
Did you hear what I just said about this muscle?
Yes, I did.
That it likes to grab onto the iliac crest and all the costals?
Oh yeah, iliocostalis muscle.
Iliocostalis. Exactly. I suspect that's what it is too. Sometimes I get these wrong, by the way. But can we see why this might be the iliocostalis, everybody? It actually attaches to the crest of the ilium. It grabs onto the costals, which are the ribs, and it hooks back into the cervical vertebrae, the transverse processes. That's what knowing attachments is helpful for. This, what I'm showing you right now, is very, very similar to your end of program test. Not the end of this class, the end of the program test that is not an open book. It shows pictures like this and says, can you identify this muscle? And this is your iliocostalis. Of course, it's multiple choice. This is your iliocostalis. Thank you very much, Ms. Felix Osuna. Yeah, cool. All right, very good. Miss Hunter. Miss Hunter,
I actually have a question
please.
on this. So, is there a similarity between iliac costalis and iliac crest?
Yes.
Okay.
So actually, so your hip, this would be me facing forward. Your hip, and I'm going to turn to the side now. Your hip is actually formed out of 3 bones when you're a little baby. Your ilium, your ischium, and your pubis. They fuse together actually right here at your hip socket and become one bone, your hips. Your hips really are, well, 2 bones. Hip on this side, hip on this side. But this is, we refer to this part of your hip as your ilium. We refer to this part as your ischium, and this part as your pubis because they were 3 separate bones at one time called your ilium, ischium, and pubis. This is the crest of the ilium, or the iliac crest. And you'll hear us talk about this a lot because your glutes hook to it, all sorts of stuff. Iliac crest.
Right.
So your ilial costalis is the muscle that hooks to the ilium and the costals, the ribs. Iliocostalis. Yeah, so it's
That makes a lot of sense.
so it's kind of, it actually, in some ways it's named by its location, its regions, iliocostalis, or its origin insertions. I don't know how you want to put it. That's exactly right. Thank you for asking that. Thank you for asking that.
Cool.
Yeah, very cool. So, what muscle is this, Miss Hunter?
Sorry, I was looking at you. Let me find. Okay.
That's okay.
So, the one that the person has their hands on.
Yeah, the one that's in red.
I hope. Did you change the slide? Because it's the iliac costalis.
Good. Yeah,
Oh,
I did on
okay.
purpose. Remember, I do everything in repetition.
Okay.
So by the way, I'm sorry, guys, because I know sometimes that makes you second guess yourself because you're like, is it that easy? But I also want to make sure you can identify this. But stay on that call, Miss Hunter, because I have another question for you. This is indeed the iliocostalis. What's this?
Erector spinae.
Erector spinae? Well, that's the whole group. So the
Sorry,
erector,
sorry.
that's okay. The erector spinae, and that actually is a legitimate answer. Sometimes you'll see them all together, but they'd be covering most of the back. So the erector spinae group is made up of the spinalis, the longissimus, and the iliocostalis.
Right. This one looks extremely close to the spine.
It is close to the
Right.
spine.
I don't know if this is the spinalis or not.
Yeah. What else could it be? Is it the spinalis
It
for
could be
sure?
the longissimus thingy-mabob, because it
Yeah.
looks long, but I don't know.
Does it, and it is really close to the spine. Does it attach to any of the ribs?
It looks like it does.
It looks like it does in this picture. So does the spinalis attach to any ribs, and does the longissimus attach to any ribs?
Oh my gosh. I don't think the spinalis attaches, or does it?
I don't think it does either. So,
Okay.
by the way, thank you for letting us go through this awkward time together. We're demonstrating how we think and learn. So what muscle do you think this is?
I think now that it's the longissimus.
Let's find out. Wow,
Oh.
good job. So we just went through with everybody how you would take a multiple choice test on this, right? Because you know the multiple choice test is going to say, and this is, by the way, for the end of the year, for the end of the entire program, but it's just a good way to kind of look at stuff, right? The multiple choice test is going to have spinalis, longissimus, iliocostalis, and some throwaway muscle like your abdominals, right? You throw that one right out. But then you start kind of doing process of elimination, you know? And that's how you start. And you have to know the attachments to know how to do the process of elimination. Very good. Thank you very much. That's awesome. Okay. Very cool. Miss Stanley. Hi. Miss Stanley, what muscle is this?
Iliocostalis.
Yeah, the muscle attaches to the crest of the ilium and the costals and then goes back into the transverse processes, kind of sweeps back transverse processes of the cervical region. Yeah, what muscle is this?
Longissimus.
Yep. Very cool. Goes all the way up to the head, all the way up to the mastoid process. What muscle is this half of, by the way? They're only showing you half of it. It's got another side on both sides.
The spinalis.
What makes you think it's the spinalis?
Because it's going through the spinous processes.
That is exactly the answer and the type of thinking I want. Thank you. It attaches to the spinous processes of the spine, which is why it is the spinalis. Yes. Thank you so much. Cool. Cool, cool, cool. All right. Okay. Miss Harper. What muscle is this?
That is the longissimus.
It is the longissimus. You're absolutely right. It goes all the way to the head, attaches to some ribs, but it's pretty close to the spine. Beautiful. I love that. Thank you very much. What muscle is this?
Still me, sir.
Yes, still you. Sorry. Still you.
It's spinalis.
It is the spinalis. Yeah, beautifully said, by the way, too. It's the spinalis, attaches to the spinous processes, the things that come out the back of the spine, the bumps on the spine, right? Spinous processes. Very good. Hey, Miss Harper, one last one since you're on a roll. What muscle is this?
It's the trapezius.
It is the trapezius. Thank you very much. That's awesome. Yeah. Cool, cool, cool. All right. Miss Hanson. Miss Hanson, what muscle is this?
The iliac costalis.
Yeah. I love that you messed up and said iliac crest because that's very correct. It is the iliac crest rib muscle. Yeah, iliocostalis. Beautiful. I love that. What muscle is this?
That is the longissimus.
That is correct. What muscle is this?
Spinatus.
Spinalis.
Spinalis.
Yep, but that's beautiful. Spinatus is a rotator cuff muscle. What muscle is this?
Trapezoid.
Or trapezius?
Yeah.
Again, I love your mistake because what mistake did she make? She named it by the shape, which is the Latin thing that it's named for. It's almost like you translated the Latin into English is all. Beautiful. So trapezius. Yeah. Very cool. I love that. Thank you. Wow. I suspect, what muscle group is this, Miss Hanson? Muscle group. Miss Hanson?
The rectus spinator.
Yeah, I suspect they're showing the whole group there. Everybody can see the stuff that's actually attached to the spinous processes, and there's stuff further out attaching on the ribs, and that makes me think they're talking about the entire group. Yeah, rectus spinae group. Yeah, good. I love it. Cool. Thank you. Beautiful. Mr. Kondaris,
Yes, sir.
what muscle is this?
Are you pointing to one, or are you just talking about the rectus spinae?
I'm one of my slide presentation.
Oh, okay. Yeah, the rectus spinae.
What now?
Rectus spinae.
That's the group. Which one of the three muscles in the group is this one?
Oh, is that longissimus?
Well, does it go all the way to the head?
It just goes up to the top cervical.
Does the longissimus go up to the top cervical or all the way to the head?
The longissimus goes all the way.
Okay.
I'm like getting the name right now though. Not gonna lie, I can't go look at my book.
You're allowed to look in your book. I don't mind.
No, I'm not. I'll do that right now.
Well, you don't need to look in your book. What is it attached to? Look at the picture. I mean, you don't even have to use fancy words. What is that muscle going to? What spots in the body?
Cervical neck.
Okay. Transverse processes of the cervical. I can see it actually attached to the side things. Okay. So maybe it's called transverse cervicalis. That's a possibility. Not a good one, but it's a possibility. What other stuff does it go to?
Looks like it attaches to some of those ribs.
Yeah, it looks like it attaches to some, even possibly all of those ribs. It's hard to tell from the picture because it could be attached underneath. So it could be called ribialis. That's a possibility. And what's the other thing lower that it's attached to?
The iliac crest.
Yeah, so it could be called iliac crest ribialis.
Yeah, I don't know why I'm brain farting. I know all three of them. I just
Yeah. So another name for ribs is costals.
Iliocostal.
Yes, iliocostalis.
Iliocostal.
Good. Good, sir. What's this one? What's that muscle, sir?
Longus.
You're right. What's this muscle, sir?
I just don't remember the name of it.
Well, what is it attaching to?
The spinous costinalis.
There you go. What he just did there is how I want you to think. I don't remember the name. It attaches the spinous processes O spinalis. Beautiful. Good. What's this muscle, sir?
Those are the traps, trapezius.
That is the trapezius, upper, middle, and lower fibers. Yep. What muscle group is this?
That looks like it's also part of the erector spinae.
Yeah, it's the entire erector group. Absolutely. Beautiful. Hey, this wasn't in this section, but we did talk about it. What? And you know this muscle because I've heard you abbreviate it before. What muscle is this?
SCM.
Yeah, what does SCM stand for?
Sternocleidomastoid.
Yep, goes from the sternum, clavicle to the mastoid process. Thank you very much, sir. Awesome, awesome, awesome. Miss Cooper. Oh, wrong way. Miss Cooper.
What?
What? What muscle is this, Miss Cooper?
Where?
On the slide, slide, slide.
Oh! I thought you were gonna point and I was like, ready. I was ready, yeah. That's hold on a second, give me 1 second.
No problem. Not a problem at all.
No, that's too high up to be your iliocostalis.
Too high up? I don't understand what you mean by high up. Oh, runs too high up the body?
Yeah.
So iliocostalis, where does the iliocostalis stop?
I think it stops, I don't know. I don't know.
Well, that would help. If you knew that, that would really help.
Well, it looks like I'm trying to remember, we learned about 3 of them.
Yes, we did.
One of them was more lateral, and I wrote about it in my,
Yeah.
home.
Yeah. Well, what other things does this muscle attach to? What can you see in the picture?
The spine.
So it's hooking onto the spine really well there?
Yeah.
What's those funny things coming out of the side of the spine that it seems to be attached to?
What is that? The ribs?
Oh, so is it attached to the spine or the ribs? Because I'm a little confused now.
Oh, the ribs.
Oh, so it's not attached to the spine. It's attached to
No,
the
I
ribs
think that
mainly.
is at the bottom, but
Yeah, and it is at the top. It's almost like it sweeps out really laterally and hooks into the top and the bottom and then on the ribs. So it attaches to, what is it attached to on the bottom?
what is it? The longissimus?
What is it attached to at the bottom? What bone is that down there?
What the lumbar,
It is the lumbar region. That bone is called the ilium.
the ilium.
Yeah. So it's hooked to the ilium and the costals, huh? The ribs, I mean.
The iliocostalis. Yeah.
Oh, wow. That's great. Iliocostalis. Which, by the way, does
Yeah.
insert into the
But I thought it was wrong.
Yeah, I know you did. I don't want you to memorize it. I want you to know why you're right or why you're wrong. What muscle is this?
That one is looking at my notes. Longissimus.
Longissimus. Very good. And what muscle is this?
That one is attached to the spine. That's the spinalis.
Cool. All right, couple questions for you, Miss Cooper, and this is for everybody's edification. A way to think about these muscles. All right.
Okay.
The answer to the questions, I'm gonna ask you some questions. The answers are one or all or two of the spinal erector muscles. So spinalis, longissimus, iliocostalis. Which one of the spinal erector or ones, there could be multiple ones, attached to spinous processes?
The spinalis.
Yep. Anything else?
I don't think so.
You are correct. So if it's attaching the spinous processes, it's the spinalis, period. Which one or ones of the spinal erectors, the erector spinae group, attached to ribs?
Oh, that's the one. Sorry, the iliocostalis.
That's correct. Are there any other ones that attach to ribs?
No, it's just that one.
It's actually the iliocostalis and the longissimus. The longissimus also attaches to ribs, it just doesn't grab onto all of them, and it's not as lateral. So this is where learning attachments kind of helps you know stuff. I'm not, by the way, trying to stump you. I want to point out ways to think about this. So spinalis attaches to spinous processes. Thank you, Ms. Cooper. And longissimus and iliocostalis attach to ribs, but the iliocostalis got its name because it attaches to all the ribs. Longissimus only grabs onto some, and it's a little more medial, right? Because it goes spinalis, longissimus, iliocostalis. Iliocostalis is swept, too. That's why it grabs onto transverse processes of the neck, and it sweeps out to the ribs and goes back to the transverse process lumbar region. So I want you to start picturing this stuff when you think about attachments and things like that. Thank you, Miss Cooper. Hey, Miss Cooper, really quick, since I've got you on the line here, what muscle is this?
Oh, is that the
Biceps brachii?
Yeah. Where'd you go? You froze.
I'm crying right now. I'm weeping.
Why?
I'm about to, because I was joking about biceps brachii. It's not on an arm, so it's not biceps brachii. What muscle is that?
Oh, I didn't even hear what you said. I just said yes because you cut out.
What muscle is this? Tell me. I want to know.
That is a muscle.
It is a muscle.
Yeah.
It is a muscle that hangs off the back of the head from the middle superior nuchal line. It comes down to the shoulders, attaches into the spine, the scapula, the acromion process, the lateral 1/3 of the clavicle. It inserts in the spinous processes all the way down to T12. It can elevate, it can depress, it can retract and adduct the scapula. It can cause upward and downward rotations of the scapula depending on which fibers are involved. And its insertion is the origin of the deltoid. What muscle is it?
There's something I want to say.
Say it.
I'm scared about being wrong.
Well, say something.
It's gonna be stupid. The trapezius?
Good. That is the trapezius. Yes, it is the trapezius all day long. Yeah.
I just said it.
There you go. Good. All right.
I just say that the whole time.
Okay. Thank you, Miss Cooper.
Sure.
I'm going to come back to you. Miss Monreal. Miss Monreal. What muscle is this? Let's review all these. Miss Monreal, what muscle?
Iliocostalis,
Yes. What muscle?
longissimus,
Yes. What muscle?
erector spinae.
It is a rector spinae group. Which one?
I'm sorry. Spinalis.
Spinalis. I know why you said erector spinae, because spinae made you think of spinalis, made you think of spinous processes. It's beautiful. That's great. Awesome. Hey, what are the actions of the three muscles that you just talked to me about?
Do they flex the back?
They flex the back.
I'm so sorry. Extend.
Oh, they're spinal. They extend the spinal column. Yeah, that's if they're working what, unilaterally or bilaterally?
Unilaterally?
Let me think. I'm going to pull on one side of my spinal rectors. I'll see what happens. Well, I do flex.
Right, but, okay, I thought you were asking me if there was an extension of the back, if you were just bending all the way back.
Yeah, and you said unilaterally. You said one side.
Okay, yes, I see what you're saying. So each one, okay, so that would be bilaterally.
Oh, let me try that. Oh, wow.
That's bilateral.
Oh, yeah.
Unilateral if you're going to one side.
Thank you. Awesome.
Okay.
Awesome. Cool. I love that. This is the trapezius. Tell me all the actions of the trapezius, Miss Monreal.
Oh gosh, Chihuahua. Okay. Well, it's going to elevate the scapula.
Thank you.
It's gonna depress the scapula.
Yep.
It can bring the head back.
Yeah, thank you. What do you call that when you bring the head back?
Extension.
Yes, it happened behind me. It's an extension. Thank you. Beautiful.
Okay. And is that it? Or
What do you mean, is that it?
I don't know.
What do you mean? What do you mean?
Okay.
You want to peel?
Okay. Wait. The middle fibers retract the scapula.
Thank you. Or retract or.
Hold on.
Another word. Thank you. Yep, and they can rotate, by the way. We can get really nitpicky because the bottom fibers can help rotate the scapular upper fibers. But good. Those were great answers. Thank you. Good. I love it when you're under pressure and you're like, wait. It's great. Makes me want to mess with you, actually. Okay. What muscle is this, by the way? It's not on the test, but you will need to know it later.
Sternocleidomastoid.
Yep, it goes from the sternum to the clavicle to the mastoid process. Hey, if you had to guess, what action do you think this muscle performs if it's working bilaterally on both sides?
Turns the head.
Bilaterally on both sides.
Okay, wait. Flexes the head.
Flexes the neck, yeah. Very good. So you didn't memorize that, right?
Right.
You just figured that out because she knew muscles could only do one thing, contract, and so she went, huh. That's how you figure out actions. Good job. Let's see what you got left. Let's see. Oh, by the way, good to know the carotid arteries there. Don't worry, you won't kill somebody, but... What muscle is that, Miss Monreal? What?
Deltoid.
Perfect. Thank you. By the way, what does it insert into down there at the bottom on the arm?
Oh gosh. Hold on.
It's a tuberosity.
Yes.
Inserts into a tuberosity. Pectoral tuberosity, biceps,
humeral.
humeral tuberosity, femoral tuberosity.
Did you hear me?
I heard you. I just didn't agree with you, so I kept talking.
Oh, okay. Hang on.
Supraspinatus tuberosity, infraspinatus.
What? Tuberosity.
Oh, deltoid tuberosity. That's convenient. Cool. Thank you, ma'am.
Hey, just real quick. My phone's about to die, so I'm gonna run to my car to get my charger.
Okay.
Okay.
We'll ask you bonus questions when you get back. Miss Yanez. Hi, Miss Yanez. What muscle is this?
The iliocostalis.
Yes. Compared to the other two spinal erector muscles, erector spinae muscles, is it lateral, medial, or in the middle of those two?
It's lateral.
It is the most lateral. Thank you very much, ma'am. What's its action?
It helps to extend
Yes.
your back.
Yes. Bilaterally, it helps to extend my back. What if just one side works? What if it's just unilateral?
It helps to laterally flex.
Laterally flex the back. Thank you very much. That's awesome. What muscles? Well, forget it. We know what that muscle is now. What muscle is this?
The spinalis.
Thank you, ma'am. Same action, same everything. By the way, all three of these muscles have the same actions. What muscle is this?
The trapezius.
Cool. What are its three insertions? Insertions are down here.
The lateral 1/3 of the clavicle, the span of the scapula.
Yes, and the thing between those two things. It's a process. Chromium process. Very good. Hey, what's the origin of the deltoid? Where it starts?
It starts at the lateral 1/3 of the clavicle, the chromium process, and the spine of the scapula.
Absolutely. Thank you. Beautiful. What muscle is this, Miss Giannis?
The deltoid.
Cool. Can you tell me all the actions of the deltoid? I don't have these memorized. You're gonna have to kind of think through them.
It medially rotates.
It does. Which fibers medially rotate?
The anterior.
Yes, the front fibers, and thank you for saying anterior. The front fibers, because they're diagonal, can actually medially rotate my glenohumeral joint. Excellent. Medial rotate.
It adducts and laterally adducts.
What laterally rotates. Medially rotates, laterally rotates.
It adducts, AB ducts.
At AB ducts, which fiber is AB duct?
The middle.
The middle for sure. Some people say all of them, but definitely the middle. That was a great answer. Cool. Because they're on the outside. Cool. Is there anything else it can do?
It horizontally adducts and horizontally AB ducts.
Thank you. Thank you. Cool. Really good answers. Let's see. This is just, by the way, it's not a question. This is just to show you all, when I talk about the deltopectoral groove, it's the groove between the deltoid and the pectoralis major. It's often a place that we'll try to like pin the arm down when we do that pectoral release and things like that. Cool. Thank you. Thank you very much, Miss Giannis. Hey, Miss Cooper. What muscle is this? They're only showing half of it, but what muscle is this?
The trapezius.
You are right. Thank you, ma'am. Okay, Miss Nguyen. Come on down. You are the next contestant on The Price is Right. My grandmother used to watch that show. I loved it. She loved it. Miss Nguyen.
Yes.
Yes. What muscle is this?
Iliocotis.
Ilial
Cotis.
costalis.
Costalis.
Yeah, great. Cool.
Yeah.
Nailed it. What muscle is this?
Longissimus.
That was beautiful. I love how you spelled that out, by the way. It is longissimus. Beautiful. Good job. What muscle is this? Spinalis. Beautiful. Great job, man. What muscle is this? Yeah, trapezius. My God. What muscle group is this? It's three muscles together. It's all three together. It's the muscle group. You've told me the individual muscles. Helps keep the spine erect.
I think I don't know how to type that.
Here, let me show it to you. Erector,
Rector
Spinae.
Spinae.
Beautiful.
Recto,
And it's all three of those muscles put together. Yeah, good.
yeah, recto,
Don't worry about this one. We're not worried about that right now. What muscle is this?
deltoid,
Deltoid. Beautiful. What muscle is this? Only half of it, but what muscle is this again?
trapezius,
Yes. Yes. What muscle do you think they're showing here in red? This is new. I mean, it's not new. We've talked about it, but you've never seen this picture before. And they've got other muscles shown in this picture, but it's the one in red. It's really big. It's kind of on your back, but kind of on your side. It's kind of lateral, but it's kind of dorsal.
is it back?
It's kind of lateral, but it's kind of dorsal, and it's the largest muscle in your upper body. Kind of lateral, kind of dorsal.
Wait one more with me. Let me see that. Wait.
Kind of lateral.
Eight.
La,
No, eight.
lat, 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 lat. Don't say lat, lateral.
Lat.
So say lat,
Last.
isthmus,
Isthmus.
latissimus. I left out the T, sorry. Latissimus.
Last. Isthmus.
Yeah, latissimus what? What is this muscle? Latissimus what? One more word. Latissimus.
Yeah. Last. Isthmus. Lateral.
Dorsi.
Dorsi. Oh.
Latissimus dorsi. Very good.
Yeah.
Mr. Yen, you are doing fantastic. You are translating, you're learning English and Latin. You said that most of those at least as well as most of us say them, and you got almost all of those right. You are doing fantastic. I don't know what the rest of you guys are doing, but you're doing fantastic.
Yeah.
You guys are all doing great, by the way. I'm teasing. But yeah, that was really, really good. That was really, really hard. All right, so this is latissimus dorsi, which is the lateral back muscle, latissimus dorsi. This big lateral back muscle. Beautiful. Beautiful, beautiful, beautiful. Thank you. Okay. Hey, Miss Torres.
Yeah.
What are the three actions of the latissimus dorsi?
Bring
What?
down the.
Brings down the arm is how we'd say it like in English. Now tell me, how do we describe bringing down the arm using fancy anatomy terms? You're on the right track, my dear. Just keep going.
The shoulders, you extend the shoulders?
Yes. So an extension of the glenohumeral joint, which is me bringing my arm down like this, does an extension. It also does this. This is bringing down the arm too, but out to my side. What do we call this?
Adduction.
So it does an extension and an adduction of the glenohumeral joint. Thank you very much.
And then immediately rotate as well, the shoulders.
Brilliant. Because it reaches up from my back underneath my armpit, it immediately rotates my arm. Because it reaches underneath, it immediately rotates my arm. Because it's coming from underneath here, it actually can turn the arm in. Beautiful. So adducts, extends, and immediately rotates. Well done. Stay on the line here, Miss Torres, because, why not? Because now that you've come out of your hammock, we can, talk about some stuff. What muscle is this?
Iliacosalis.
Yes. What muscle is this?
Longissimus.
Yes. What muscle is this?
Spinalis.
Yes. Don't tell me. Wait 1 second. Miss Cooper, what muscle is this?
Trapezius.
Thank you, ma'am. All right, Miss Torres. What muscle group is this?
Spinae group.
What are the two actions of the spinae group?
Working unilaterally, lateral extension.
it's flexion, lateral flexion. There's no lateral extension. I don't know why, but there's no lateral flexion. Lateral flexion, cool.
Flexion and then extension of the back when they work by laterally.
Yeah, because both sides are pulling me back. Yeah, I love it. Good job. What muscle's this?
Deltoid.
Good. What action are the middle fibers of the deltoid responsible for?
Adduction.
Really? The adduction? They pull my arm in?
Abduction.
Oh, abduction. Good, good. Whew. I got scared there for a second. What two actions are the rear fibers responsible for?
Laterally rotation,
Yep.
and then horizontally,
Yeah, horizontal what?
abduction.
Yeah, really good, by the way. That one was tricky. And by the way, I lied. There's actually one more thing they can do. I'm doing it to help you.
Extend.
Yeah, extension. Thank you.
Extend,
What
yeah.
what three actions, this is what I should have said in the back one. What three actions can the anterior fibers perform?
Flex the shoulder, medially rotate the shoulder, and horizontally adduct the shoulder.
Beautiful. Thank you. Nicely done. Cool. What muscle is this? Ms. Torres? You're not.
Latissimus dorsi.
Cool.
Dorsi.
And what were the three actions it could perform again?
Extend the shoulders. Extension of the shoulder. No?
Yeah, that was extension of the shoulders. I'm just showing you the next one I'm expecting you to say.
Oh, adduct the shoulders.
Adduct
and
the shoulder.
medially-
Beautiful.
And medially rotate the shoulder.
I love it. Beautiful. Another beautiful picture of the latissimus dorsi here. Absolutely gorgeous. Yep. Cool, cool, cool. Thank you, ma'am. Miss Petrie. I feel like somehow I skipped you over at some point. And I don't want you to feel left out. What muscle is this, Miss Petrie?
The iliocostalis.
Yeah. What muscle is this?
That one is the spinalis.
Beautiful. Beautiful, beautiful, beautiful. What muscle is this?
Trapezius.
Yes. What muscle is this?
Deltoid.
Yes. I like you're saying it like a game show thing. Deltoid for 500, Jack. What muscle is this?
That is the latissimus dorsi.
Beautiful. What muscle is this?
That would be.
And if you need a hint, I will give you one.
I'm thinking of its location.
Yeah. Its location is it's inserting to the lateral border of the scapula, close to the inferior angle, down at the bottom. That's its origin. And it goes over and actually inserts in the front of the humerus from underneath the arm.
I want to say it's an infra, but I don't think that's bad.
It's not, but you're in the right area at least. It also can perform three actions. It can perform an extension, an adduction, and a medial rotation. Just like the latissimus dorsi. So it has the same actions as the latissimus dorsi. I wonder if that's a clue.
Has the same action.
So anytime I say latissimus dorsi, you say,
Teres minor?
is latissimus dorsi big?
Yes.
So you would say teres.
Major.
Yes! Beautiful. Anytime I say latissimus dorsi, you say teres major. That happens to be the teres major. Beautiful. Well, come on. Teres major. Beautifully done. Beautifully done. Thank you. Thank you, ma'am. Miss Felix Osuna. Miss Felix Osuna, what muscle is this? They're only showing half of it, but what muscle is this?
That's the traps.
That's the traps, trapezius. Thank you very much. What muscle is this?
Latissimus dorsi.
That is correct. What muscle is this?
That's the teres major.
What are the three actions of the teres major?
Extends, adduct, immediately rotates the shoulder.
Wow. Okay. Beautiful. What? Oh, sorry, I went the wrong way. They're trying to show you, by the way, the thoracolumbar aponeuroses here and how the lats go down into it. But anyway. All right, smarty pants. Miss Felix Osuna, what two muscles are they showing here?
Is that the teres minor with the oh no, that's the supraspinatus with the scapula.
Is it above the spine of the scapula?
No.
So it's not the supraspinatus. Yeah, but the infraspinatus is found right below the spine of the scapula. This stuff's found even lower. You were on the right track when you first started thinking.
Oh, okay. So would it be the teres minor?
But it's two muscles. Teres minor and what? Notice that one is attached to the back of the arm and one's attached to the front of the arm. It's going around to the front. That's what they're trying to show. One's on top of the other. One's kind of bigger than the other. The other one's smaller than the other. One's kind of major and one's kind of minor.
So teres minor and teres major?
Yeah. We don't normally talk about them together because they do different stuff, but they're named teres minor and teres major because they are together on the body. You find them together on the body. So which one is the minor?
That would be the top one.
Yes, you're exactly right. The minor rides on the shoulders of the major. It is smaller. Yes. Thank you very much. Good job.
Thank you.
Miss Balatic. Miss Balatic, what muscle is this? Oh, well, I hope you know. All right. Miss Balatic, since you hopefully know this is latissimus dorsi, what three actions can it perform?
This is the thing I suck at the most.
Bringing my arm down in front. What do we call that? In front, going towards the back. But anyway.
Extend.
What?
Extend.
Yes, can create an extension. Bringing my arms back to the side of my body. What'd you say?
Abduction.
Adduction? You mean they're adding them back to my body?
Yeah.
That's what you meant. And then I can turn my arms in because of this too. Kind of rotate them in.
Rotation.
What kind of rotation?
Medial rotation.
Medial rotation. I thought you sucked at this stuff.
I do.
Oh.
It's confusing.
Well, it's very confusing. I'm confused, but you're doing very well. Cool. Not bad at all. What muscle is this? Anytime I say latissimus dorsi, you say?
The teres major.
That is right. That is right. What are the three actions of the teres major?
Extension.
Yes.
Adduction.
Yes.
Medial rotation.
Yes. Hey, really quick question. What are the three actions of latissimus dorsi?
Adduction, medial rotation, and flexion or extension.
Yeah. Hey, really quick question. What are the three actions of the teres major?
Adduction, medial rotation, and extension.
Yeah. Do you notice a similarity between the teres major and the latissimus dorsi?
Yeah, they do the same actions.
Yes. That's why anytime we say latissimus dorsi, we say teres major. Beautiful. I love that. What two muscles are we seeing here? You've already identified one of them.
Yeah. The teres major and minor.
Yes. If there's a major, there's a minor, and it's probably close by. Which one is on top? Most superior.
Minor.
Yes. Thank you very much. Well done. Miss Hunter. Miss Hunter, what two muscles are we looking at right now?
Oh my god. That's the teres major?
Yes.
Oh, okay. I didn't. You didn't move, so I was like, what happened?
Well-
Straight up, it looks. I know you just went over this, but it looks like it's underneath the scapula. I want to say subscapularis, but I don't know.
No, we can't see it underneath the scapula. It's a bone.
Oh, that's a bone. Okay. Well, I didn't know if the picture was portraying that. Anyway, I don't know what the other one is.
So what's the one that he's almost touching? What'd you call it?
That's, I think, the teres major.
I think you're right. If there's a teres major, is there another teres?
Yes. Oh, okay. I didn't know they were so close. I mean, I knew that, but I didn't. Okay. teres minor.
Yeah. Yeah. Cool. Yeah. The major always keeps an eye on the minor. They do very different things, but they're found next to each other. That's how they got named that way. Cool. All right. What muscle is this? And it is not the teres major or the teres minor. It is found below the spine of the scapula.
Is that the infraspinatus?
You mean you just copied me. You just said what I said, but you said it in Latin. You just said below the spine of the scapula muscle. Infraspinatus is 100% correct. Infraspinatus is 100% correct. Hey, what is the action of that muscle?
Is it to depress the scapula?
Well, it hooks to the scapula and doesn't hook to the body, so it can't do anything to the scapula. It runs from the scapula over to the humerus on the outside here. So when it contracts, something's going to happen.
Oh, I'm gonna say externally rotate.
Yeah, just give me a different term, but that's actually true. Externally rotates is legit. We also call that a lateral rotation.
Lateral rotate.
But I think external rotation would be legit. I sure understood what you meant. Beautiful, beautiful. So this is the infraspinatus. It does a lateral rotation. I love that so much. By the way, this is part of a group of muscles. Do you remember what this group of muscles is called?
Rotator cuff?
Yes. Some people, by the way, I hate this, but some people call it the SITS group because SITS stands for supraspinatus, infraspinatus, teres minor, and subscapularis. But it is the rotator cuff muscle group. Yes, you are exactly right, madam.
Yay.
Another picture of that, beautifully done. Hey, what two muscles, Miss Hunter, before I let you go, what two muscles, assuming you get this right, what two muscles are pictured here? One's in red, one's in gray or whatever, but what two muscles are pictured here?
So much pressure.
They both go to the, what? Go ahead.
You said both what? Give me
They,
the hint.
they both go to the same place, they both have the same action.
Oh, okay. Teres.
And if they weren't colored differently, you wouldn't be able to tell them apart, really. I'm sorry, what'd you say? Teres what?
Major? Teres major.
Teres major and what?
Oh God.
Anytime I say teres major, you say,
I thought it was the latissimus dorsi.
I did too. Do you see the latissimus dorsi in this picture?
I thought I didn't see it.
Nah. So, since these have the same action, it's probably not teres major. Since there's no latissimus dorsi.
Right. Okay.
So,
Teres Minor then?
anytime I say teres minor, you say what?
I did know Teres Minor had
A buddy?
connected- Yeah.
Anytime I say well, what is that other muscle above it there that is below the spine of the scapula that you've already identified?
Oh, I already did. Okay, I thought it was a whole because it looks like okay, infraspinatus.
Yeah, anytime I say teres minor, you say infraspinatus. They are.
Okay.
You can't tell them apart when you're rubbing somebody. They're in my mind they're the same muscle. They're not really, but they are. Anyway, that picture is a great example of why they get lumped together. So it's confusing, everybody, because you've got the teres major, teres minor, infraspinatus, and teres major and teres minor were named because they were so close together, but they don't work together at all. The teres minor and infraspinatus work together very much. They're very hard to separate. That is teres minor and infraspinatus. Infraspinatus, teres minor. Good job, Miss Hunter. Thank you. Thank you, thank you, thank you. Okay. Miss Stanley. Miss Stanley, are you there?
No.
Yep. What muscle is this?
Latissimus dorsi.
Thank you. What muscle is this?
Teres major.
Yes. What two muscles are this?
Teres major and minor.
Yes. Which one's on top?
Minor.
Yes. Which one's on bottom?
Major.
Yes. What muscle is this?
Infraspinatus.
Yes. Excellent. Below the spine and scapula. What two muscles are these?
Infraspinatus and teres minor.
Yes. Which one's on top?
Infraspinatus.
Which one's on bottom?
Teres minor.
Beautiful. Okay, this one's tricky because of the picture. We are looking at the back side of the scapula, believe it or not. We're looking at the back side of the scapula, believe it or not. Underneath the scapula, what muscle is this?
Subscapularis.
Yes, it is the subscapularis. You can actually access the subscapularis, everybody, by going in through the armpit carefully. Usually through a sheet because people are really ticklish. Subscapularis. Beautifully done. Can you tell me the action of the subscapularis? It actually reaches from underneath the scapula to in front of the humerus. So it's underneath the scapula. What?
I think of it as like reaching, but like is it extension or?
It's one of the rotator cuff muscles, so it probably rotates. Not guaranteed, but
So laterally rotate.
so laterally rotates. Well, if it grabbed on behind, it would laterally rotate, but it grabs on in front.
Oh, so it's medial.
Yeah.
Medial rotate.
Medial rotation. Thank you. That was awesome. Good job. Cool beans. All right, Miss Harper.
Yes, sir.
Yes, ma'am. Miss Harper, you already know what that is. Miss Harper, what are these two muscles?
That is the teres major and teres minor.
Yeah. Do they share similar actions?
No.
No, they just share a location. Yeah. What muscle is this?
The infraspinatus.
Yes, ma'am. Infraspinatus, below the spine and scapula. What two muscles are these?
The infraspinatus and the teres minor.
Yeah, what's their main action that they both do together?
They externally rotate.
Externally rotate, because you're copying Miss Hunter. What's another word for external?
The lateral rotation.
She's right, by the way. You're both right. I just want to do both. Anyway, lateral rotation. Excellent. Beautiful. What muscle is this?
That is the subscapularis.
And what is its action?
It's the medially rotation.
Yes. So everybody, this is the back of a back. The infraspinatus and teres minor do a lateral rotation. The subscapularis does a medial rotation. The infraspinatus and the teres minor are on your backs, and they do a lateral rotation or an external rotation. The subscapularis is actually, it's underneath the scapula, but it's in front of your body, and it grabs on the front of the humerus, it does a medial rotation or an internal rotation. Cool. Thank you. Let's see. Let's give you one more, Miss Harper. Let's see what we got here. What is this muscle, Miss Harper?
It's the supraspinatus,
Why do you think it's the supraspinatus?
because it's the top. It's the top of the infraspinatus.
Yeah, it's on top of the spine of the scapula. And it actually goes, you can actually see it in the picture going underneath the acromion process and inserting into the head of the humerus. This is the one rotator cuff muscle that doesn't rotate. What is the action of this muscle?
That's
abducts. Yep, it abducts the humerus. Thank you. Beautiful. Thank you very much. Miss Hanson. Hi, Miss Hanson. What two muscles are these?
teres minor and teres major.
Beautiful. Which one's on the bottom?
Major.
Thank you. What muscle is this?
That's the infraspinatus.
Yep. What's its main action?
Laterally rotate
Yes.
the shoulders, adduct the shoulders, and stabilize the head of the humerus.
Sure. Pulls back in. Main thing, it'll laterally rotate. Beautiful. What two muscles are these? Miss Hanson?
Oh, sorry, infraspinatus and teres minor.
Cool. What do they share in common?
They do the same actions.
Yeah, beautiful. Thank you. What muscle is this?
Subscapularis.
Yeah. What's its main action?
It is to medial rotate.
Yes. So it could argue with what other two rotator cuff muscles?
The rhomboids.
It could argue with what other two rotator cuff muscles that do the opposite?
Is it the infraspinatus and the teres minor?
Yeah. Yeah. I don't know if they do, but I just want to point out one pulls forward, the other two pull back. Right? Cool, cool, cool. What muscle is this, Miss Hanson?
Supraspinatus.
Cool. What's its main action? It actually grabs over the top of the shoulder on the outside here.
It's to abduct.
Yeah, very cool. I love that. Okay. This isn't necessarily new. What muscle do you suppose this is? Just a different picture.
Is that the teres minor?
It is. How did you figure that out?
It's underneath the scapula.
Well, it's not really underneath the scapula. It's on the posterior side of the scapula. But lots of stuff's on the posterior side of the scapula. I'm not quite sure what you're saying.
It's below inferior.
Okay, so why wasn't it the infraspinatus, though?
What?
Why wasn't it the infraspinatus if it's below?
Because that's on the scapula.
Oh, and this thing's off the scapula but below. Okay.
Yeah.
And it wasn't all the way below. If it went down further, closer to the inferior angle of the scapula, what would it have been?
Teres major.
Yes, thank you. I love the way you're thinking. I just want to kind of check. You were right on. That was awesome. All right. Cool. All right. Thank you, ma'am. Mr. Kandaris.
Yes, sir.
Mr. Kandaris, what are these two muscles that we're looking at? We're just about done, everybody, by the way. I know this is a lot.
Teres minor and teres major.
Cool. Which one's on the bottom?
Major.
Cool. Which one medially rotates?
Minor. Major.
Which answer are you deciding on?
I'm gonna go with minor.
Minor medially rotates?
No, it's the major.
Why does the major medially rotate? You're right. Now.
No, I just did it and I felt it contract.
Okay. So where does it insert that it's allowed to medially rotate?
I'm sorry?
Where does it insert that it immediately rotates? Because on the backside of your body, it's kind of interesting that it immediately rotates. Where does it insert that it immediately rotates?
Inferior point of the scapula.
That's its origin. That's good. Thank you.
Okay, so
Where- It inserts in front on the humerus here. And that's why it's able to immediately rotate. That's why I was just kind of looking for that. Thinking. That's why it's able to grab here. It actually comes up from underneath my armpit and can pull the humerus in immediately. If it didn't get to in front of my humerus, it could never immediately rotate.
Okay.
Cool. These are tough questions. Don't misunderstand me. What muscle is this?
The subscapularis?
Is it underneath the scapula?
No, that's on top. That's on top. So that's the. We're doing rotator cuff muscles, right?
Yeah, or biceps or triceps. Could be the deltoid. Might be the trapezius. Probably not the latissimus dorsi.
No way.
Have you been watching these while we've been doing them?
Yeah, but that's too small.
I know, I'm just messing with you at this point. What muscle is that? I know you know this. What bone is it on top of?
The scapula.
Good, okay. And what feature is it close by on the scapula, or above or below, or
It's more inferior.
inferior to what?
The top of the scapula.
Yep, or even the spine of the scapula, some might say. This is the spine, and it's right down here.
Supraspinatus.
Oh, good, it's on top of the spine.
Wait, what?
You just said the muscle on top of the spine, supraspinatus, above the spine.
So, isn't that it?
Is it on top of the spine of the scapula?
Yes.
Really? Because I feel like this muscle's on top of the spine of the scapula,
I see it now.
and I feel like this muscle is below the spine of the scapula.
The infraspinatus.
Yeah, good. All right. What two muscles are these? One's in red, one's in gray.
The red one is that the subscapularis?
We're still not underneath the scapula. We'd have to like lift the scapula up to be
Teres minor.
cool. Teres minor. What's the other one?
Infraspinatus.
Thank you, because they go together. Good. All right. Hey, what's the main action of the infraspinatus? Sir?
I'm trying to do it right now.
Cool. It's in back. It's a rotator cuff muscle.
What is it? Abducts?
Well, but it's a rotator cuff muscle. Can't abduct. You got to be on the outside of the body to abduct.
It medially rotates.
So it's in front of the body and it grabs on and pulls it in.
It's on top, so then does it laterally rotate?
It's on top. I feel like the muscle we're looking at right now is back here behind the body, right? And it's got to contract, so it's got to do something back there, doesn't it?
So it pulls.
Definitely pulls. All muscles pull. What kind of rotation does this muscle that's found on the backside of the body create?
A medial rotation.
So it turns my arms in. Where would I have to be to turn my arms in? What?
Lateral rotation.
Yes, I have to be in back to pull my arms back. Lateral rotation. Good. That was the infraspinatus. Creates a lateral rotation. Perfect, perfect, perfect. Thank you for going through that with me. What does the teres minor there, what kind of action does it create?
Medially rotate.
It medially rotates, so it does the opposite?
Yes.
So anytime I say infraspinatus, you say what?
Teres minor.
And why do I do that?
say one does the opposite of the other?
No, because they share an action, sir.
Oh, they share an action.
So they both they both laterally rotate. Yeah. Infraspinatus and
Jack,
Terry's.
stop already, Jack, stop. You know everything I know. You're my lab partner. I know you know everything.
He's good. I just got him on the run,
What's
and I.
going on with you?
All right, awesome, sir. So Terry's minor and infraspinatus, which you know go together, which is good, do the same action. Cool, cool, cool. All right. What muscle is this, Mr. Kandaris?
The
It's one of your favorite ones to call out lately.
is it the they're all like the same. Oh.
I know, but I've shown the slide several times. That's why I want to make sure you're watching the slideshow. I'm worried that you're getting distracted.
Is it the subscapularis?
It is the subscapularis, sir. Good job. And it is a very hard picture to interpret. Which muscle is this?
Supraspinatus.
Good job. Awesome. This one's by itself, but we've already talked about it. Which muscle is this?
Teres minor.
Yes. Good job. Now you're on a roll. Okay. All right. I don't even. What is this? The erector spinae group again? Yeah. Okay. Thank you, sir. Okay. Miss Nguyen. New muscle. We've learned this, but we haven't talked about it. What muscle are they showing us right now? It's kind of the Christmas tree muscle. It runs from your scapula over to your spine like this. And it has a major and a minor. What muscle are we showing right now? Has a major and a minor, and it's on the back there. And by the way, you're muted, so we can't hear you.
You're asking me, yeah?
No, Stanley. It has a major and a minor in the name. I want to hear major, minor, something. Something major, minor.
Major and minor. I think that around the super C. I don't know how to say that.
How about rhomboids?
Lomboid.
Rhomboids, major and minor.
Yeah, lomboid is the rhomboid.
Major,
Major.
minor.
Minor.
Good.
Yeah,
All right.
lomboid. Yeah, lomboid.
Okay.
I'm
Cool.
sorry.
Don't be sorry. It's okay. You guys have never seen these pictures before. I'm throwing stuff at you. You're in front of everybody. It's okay. Totally okay. Yeah. Although I'm going to come back and ask that question again. You know me, Miss Nguyen, right? Okay, good. All right, Miss Yanez. Okay, Miss Yanez. Let's do some quick review. What muscle is this, ma'am?
The iliocostalis,
Thank you. What muscle is this?
the longissimus,
Yes. What muscle is this?
the spinalis,
Yes. What muscle is this?
trapezius,
Yes. What muscle group is this?
the erector spinae,
Yes. What muscle is this?
the sternocleidomastoid.
Clidal. It doesn't matter. It's not in our section right now. Sternocleidomastoid.
Sternocleidomastoid.
Yeah. What muscle is this?
The deltoid,
Yes. What muscle is this again?
the trapezius,
Yes. What muscle is that in red?
the latissimus dorsi.
Very good. What muscle is that? Anytime I say latissimus dorsi, you say
Teres major,
yes. What two muscles are that?
the teres minor and the teres major,
Yes. What muscle is that?
the infraspinatus,
Yes. What two muscles are those?
The infraspinatus and the teres minor.
Thank you. What muscle is that?
The subscapularis.
Yes. What muscle is that?
The supraspinatus.
Yes. What muscle is that?
That's the teres minor.
Beautiful. Yes. Don't worry about that. What muscle is that?
The rhomboid.
Yes, it is the rhomboids. Give me the full name.
The rhomboid's major or
And?
minor.
Yeah, it's together. That's all. Thank you. Good. Thank you. Thank you. Thank you. Thank you. Mr. Kandaris. Sir? Are you there? Mr. Kandaris, I didn't lose you, did I?
I'm here.
Oh, good. Thank you, sir. Mr. Kandaris, what muscle is this?
The iliocrustalis,
Beautiful. Thank you, sir. What muscle is this?
longissimus,
Yes. What muscle is this?
spinalis,
Yes. What muscle is this?
trapezius,
Beautiful. What muscle group is this?
rectus
Beautiful. What muscle is this?
sternocleidomastoid,
Thank you. Thank you for the full name. What muscle is this?
deltoid,
Yes. What muscle is this? I just did it. Never mind. What muscle is this?
latissimus dorsi,
Beautiful. What muscle is that, sir? Anytime I say latissimus dorsi, you say.
teres minor, major,
Thank you, because it's big, so major. Yes. Latissimus dorsi, teres major. What two muscles are these?
the teres minor and major,
Yes. Which one's on top? Most superior.
minor,
Thank you. What muscle is this?
infraspinalis,
Yep. Infraspinatus. Beautiful. We'll take it, though. We'll take it. That's good. What two muscles are these?
the infraspinatus, and the teres minor,
Yep. Anytime I say infraspinatus, you say teres minor. Why is that?
because they have the same lateral action,
Thank you. Good job. Lateral rotation. Beautiful. Great answer. What muscle is this?
subscapularis,
Beautiful. What muscle is this?
supraspinatus,
Yes. What's this one?
is that also the teres minor,
It is. Good one. That one's hard. What muscle is this?
rhomboid,
Yes. Major or minor?
major,
And minor. But yes. Good. Trick question.
They look,
Yeah. Trick question. Good job, sir. Thank you. Okay. Hey, Miss Nguyen. Miss Nguyen, what muscle is this?
Lumboid minor and lumboid major.
Thank you. Rhomboid major and rhomboid minor. Beautiful. Nicely done. Oh, I'm going the wrong way. I was like, why is this giving me answers back? Rhomboid's good. Miss Nguyen, what muscle, this is a new one, what muscle do you think this one is? It goes from the scapula up to the neck. I think it might help to elevate the scapula.
Scapula on the neck.
Yeah, I think it might help to elevate the scapula.
I think.
Yeah.
On the neck.
Yeah. I mean, if I named it, I would even name it the like elevating scapula muscle. Yes. Yes.
Ladder. I don't know how to talk that. Ladder.
Vader
Fader.
scapula.
Scapula. Yeah.
Levator scapula. Beautiful. Thank you. Hey, what's the main action of the levator scapula? What does it do?
Elevation.
Yeah, elevation scapula. Beautiful. Thank you. Okay. Beautiful, beautiful, beautiful. Miss Monreal. Miss Monreal,
Yeah.
what is this muscle in red here?
Serratus anterior.
Yes. What does serratus mean?
Tooth-like.
Yeah, saw-like, tooth-like. Yeah, we'll take it. What does anterior mean? Yeah, the saw-like muscle in front of your body. Yeah. What's its main action or two?
Okay, well, I know it like fights with the rhomboids.
Good point. So it might do the opposite. That's a really good point.
Okay,
It's also in front, so it's
and
good.
the rhomboids, retract the
Yeah.
scapula, which would be adduct, so is it going to abduct the scapula?
Yep. Or protract.
Okay.
Yep, it's in front so it can pull my scapula forward. Yep. It also, by the way, it's hard to tell in this picture, but it's running down the ribs. The ribs run down a little bit, so people can say can depress too, the scapula, whereas the rhomboids can elevate a little bit. But I wanted what you were talking about. It protracts or abducts the scapula. Beautifully. Beautifully done. That's good. Just stay on the line there, Miss Monreal.
Okay.
Let's do a little quick fact check here just to make sure that you know what you're talking about. All right, what muscle is this, Miss Monreal?
Teres major.
Yeah. What two muscles are these?
Teres major and teres minor.
Yeah, which one's on top?
Teres minor.
Yeah, anytime I say teres minor, you say what, though?
Infraspinatus?
Yes,
Major,
infraspinatus.
yes.
Any infraspinatus, but anytime I say teres major, you say what?
Latissimus dorsi.
Yeah, yep. So in a way, not even in a way, the teres minor goes with its buddy upstairs, the infraspinatus, and the teres major goes with its buddy downstairs, latissimus dorsi. Beautifully done.
Mm-hmm.
What muscle is this?
Infraspinatus.
Yes.
Is that correct?
Yes.
Infraspinatus.
What?
I always want to say infraspinalis, but
You're fine. What two muscles are these?
Infraspinatus and teres minor.
Yes. Beautiful. What muscle is this?
Subscapularis.
Good. What's the main action of the subscapularis?
Ah, come on, man. I'm just hang on.
It's if this was my scapula and you could see through my chest, you'd see this. This is the subscapularis. It grabs on.
Immediately rotate.
Yeah. Right.
Okay.
So if it was going to argue with any muscles, who could it argue with? Muscles that do the opposite.
Rhomboid.
That's stuff that grabs on the entire scapula. This just these
Okay.
muscles just fight for the humerus.
Okay. Oh, deltoid anterior.
I like what you're thinking.
Immediately
I like what you're thinking.
Posterior.
I like what you.
Fibers of the deltoid.
Yeah, I'll give you that. I'll give you that. I'll take it. Also the infraspinatus and the teres minor, but you're absolutely right. The rear deltoid fibers works. Good. Okay.
I was gonna work my way over there, but okay, sorry.
No, the logic is correct, and you're probably right about that one. What muscle is this?
Okay. Supraspinatus.
Yes, it's the only rotator cuff muscle that doesn't rotate. What does it do?
Abducts the
Yeah.
shoulder.
Yeah, it abducts the shoulder. Yeah. Don't worry about that yet. What muscle is this?
Rhomboids major and minor.
Thank you. What muscle is this?
Levator scapula.
Yes. I hope. And what muscle is this?
Serratus anterior.
Yes. What muscles? Oh, well. What muscle is this?
It's pectoralis major.
Yes. What muscle is this?
Pectoralis minor.
Yes, the three-fingered muscle going down. Good. What muscle is this?
Biceps brachii.
How can you tell it's biceps brachii? You are correct, but how can you tell?
The two heads.
You can see the two
And
heads.
in the brachial region.
Yep, there it is again. And it's in the brachial, thank you. And it's in the brachial region. What muscle is this found underneath the biceps brachii?
Okay, I forget, but is it brachialis?
Yeah, brachialis. Just means like arm muscle, right? Because that's all it does is just sit there and bend the elbow all day long. Beautiful.
Okay, so when you tap your brachial region twice, so remember when you were making it, okay, so that's going to be for those two, right? The bicep brachii and the brachialis.
Yeah, I do it to remind myself there's a two-headed muscle here, And also there's another muscle under the two-headed muscle, right? So
Okay.
biceps brachii and brachialis is underneath.
Okay, what's the skinnier one that goes up a little? It was something.
Are you talking about the coracobrachialis?
That.
Yeah, that's a skinny one that goes from the coracoid process over to here,
Yeah,
coracobrachialis. What muscle's this?
Okay. Tricep.
It is triceps brachii. You can't see the third head, everybody, because it's hidden underneath those two heads, but there are three heads.
Okay.
What is this muscle, Miss Monreal? You better get it right, because I just told you it.
The,
Hurry, quick, now!
okay, you just said it. Hold on. Coracobrachialis.
Yes, coracobrachialis. It goes from the coracoid process of the scapula that's in front over to the brachialis, right like this. Yep, coracobrachialis. Beautiful. Beautiful, beautiful, beautiful. That's just showing you the brachialis underneath the biceps brachii. Okay. Thank you, Miss Monreal. All right.
You're welcome.
Okay. All right, everybody. Actually, let's take a break from this. Let's take a break from that. That's enough. All right, let me stop sharing. Boom. Okay. That kind of goes over a lot of the muscles that you should be knowing right now and helping you identify them. Now, this is maybe going to upset you, but I don't know that what we did today is going to help you with tomorrow's test that much, but tomorrow's test is an open book. What we did today will help you in life and as a massage therapist and for your end of program test. I wanted to start getting you used to thinking about how stuff does actions and where it's found, and we will be doing more of this. It will keep mounting up. Because this is actually really what I want you to be able to do. I want you to be able to go, the muscle's there. I know it's above this other muscle. I know it does this thing. I can tell it from this other muscle because it doesn't attach here and there and all that kind of stuff. All the logic that you guys were displaying today, each and every one of you. I mean, I watched each and every one of you do it. That type of logic and kind of feeling your way around through your head and through the human body is what I want you to see doing. And you did it beautifully. Beautifully. Like we are just 25% of the way through the program. And I'm sure that I hope all of you sat there at times and went, oh wow, I didn't know that, I forgot that. Yeah, good, I expect that. But my point is you understood what we were doing. I'm assuming you didn't feel completely lost. You at least went, oh yeah, it's in front. Of course that has to be the way it immediately rotates. Of course, like I didn't know that, but now I understand it. So you're at least understanding the concepts, even if you can't pull them up at will yet. Yeah? Yes. Okay. So let's go around and talk about what we learned today, or what you want to remember from today, or some important fact from today. And if you don't have anything, that's okay too. I will just quiz you on some things. I'm happy to do that. It's my favorite thing in the world to do. So that's fine too. So Miss Monreal, you just appeared on my screen. Tell me something of value that you want to remember from today. I know you might not have learned anything from today, but like something of value, anything that struck you, anything. Stuff you want to remember for your future. You're on mute.
The top.
What? Ms. Monreal, I'm going to come back to you in a minute because we're having some lag time on you. I'll come back to you, I promise.
I'm on mute.
Oh no, yes, now maybe it's working. Try it.
Can you hear me?
Yes.
Can you hear me?
Yes.
Okay. So, I just wanted to say, well, here's my thing that I got. The whole process of learn. I like how you go over it, and even when somebody does what you walk them through it. And I wanted to say that I was super impressed with Miss Stanley.
Oh my gosh. Miss Stanley, I heard she's super impressed with you, but I don't know why. You got cut out right before the compliment.
Oh,
Maybe you should be back on your phone.
okay.
All right, we'll come back to you. Miss Felix
Oh,
Os.
good.
Okay, Miss Felix Osuna.
Yes.
Stuff that you want to remember from today.
Well, I actually forgot how the rhomboids look like, so that's what I've been saying.
Good. And how do the rhomboids look like? What do they look like?
Like a sheet of paper.
They do actually. They're pretty thin. They look like a sheet of paper. Yeah. And what? How are they running? What direction are they running? Where are they running from and to, and all that kind of stuff? Just roughly.
Well, just like right in the middle of the bag.
They're right in the middle of the back, and they're essentially running from what? From what border of the scapula is this?
Is that the medial?
Yeah, medial border. They're running over to the spine, right? And they're running at a diagonal.
Yes.
Cool. Got it. Which means, by the way, they can perform what two main actions? You could argue three, but
Does it help like doing the abduction of the shoulders?
yes, it does help to abduct the scapula, to pull it back in, to retract it. Absolutely, that's its number one action, I would say. They also run diagonal, so what's the other thing it could do if it contracts?
Elevate?
Yeah, elevate the scapula too. Some people argue it can downward rotate the scapula too because it's grabbing on the bottom and it can kind of help downward rotate it. But that was good. Thank you. All right, Miss Monreal, you want to try it again? Second time's a charm.
Okay, can you hear me?
Yes. Tell us about Miss Stanley, because that was a cliffhanger.
Okay, I just liked how you had asked about the two-headed muscles, and she remembered the one that was attached to the femur.
Yes.
And that was like way in the beginning. That was one of the first few things, like what, maybe the first day. So I really hope you know that we do try to pay attention, and I do like the teaching process.
Oh, good. All right, cool. And yeah, that was very impressive. In fact, Miss Stanley, you caught me off guard because I wasn't expecting you to be able to draw that information out. Yeah, really good. Thank you. And thank you for pointing that out, Miss Monreal. And thank you for the compliment. Miss Stanley, since we're talking about you and praising you, what do you want to remember from today except beyond the fact that you're awesome?
Well, kind of the whole two-headed thing, like she brought up, remembering the bicep femoris and all that. I try to think about it all the time because whenever I think of the numbers, I try to keep them all together.
Cool. So you want to, I mean, I'm oversimplifying what you just said, but you do want to remember bis mean 2 and tris mean 3 and quads mean 4 and that
I try to
concept.
remember all of them, not just like upper body, like
Yeah.
lower. So.
Got it. So when you learn that, you try to learn all the muscles that have like biceps femoris, biceps brachii, quadriceps femoris. We'll get to that. Cool. I like that. Thank you. Miss Cooper?
Hello.
Hi, Miss Cooper. Tell us something of value from today.
I didn't know that rectus means like up and down.
Yes, it does, and that will matter later. We have 2 rectus muscles. Yeah, really helpful.
It's very helpful.
Yeah. Rectus helps keep you erect. Rectus, yeah, that's where that term comes from. Up and down. Yeah, thank you. Miss Torres, tell us something. Speak to us.
The what is it?
Coracobrachialis. Coracobrachialis. It goes from the coracoid process to the brachial, to the arm, yeah.
I had forgot about the muscle, like,
Yeah.
like when I saw it in the picture, I'm like, what?
Hey, Miss Torres, what do you suppose the actions of that muscle are?
Flex the shoulder. No. Yeah?
Yeah, I'm doing it right now. If I shorten it and flex the shoulder, hey, what else do you think it might do?
Adduct the shoulders, like horizontal adduction.
Horizontal adduct, adduct, yes. Thank you. Well done. Good job. Miss Bilotic, Something from today.
I think I learned more about the rotator cuff muscles.
Yeah, what are all 4 rotator cuff muscles? There's 4 of them.
Infraspinatus.
Anytime you say infra, you should say what next?
The supraspinatus.
No! Don't do that! Oh my God! No, no, no. Anytime you say infraspinatus, you should say...
The radius anterior.
No, that's not a rotator cuff muscle. All right. All right, stop 1 second. This is important for everybody. It's not just you. Don't worry. There are 4 rotator cuff muscles. People remember them by sits. Everybody say supraspinatus, infraspinatus, and anytime I say infraspinatus, you say teres minor, and then subscapularis. That's sits. Supraspinatus, infraspinatus, teres minor, subscapularis. It's fine that you start with infraspinatus, but I want you to say teres minor always after it because they're found together and they do the same thing together and they feel the same way when you rub somebody. So, what are the 4 rotator cuff muscles, Miss Bilotic?
The supra, the
Wait, super what?
supraspinatus, the infraspinatus, the teres minor, and I'm blinking.
Little, like a submarine? Submarine?
Subscapularis.
Yeah! Awesome. That was awesome. Thank you, ma'am. No, you're doing good. That was good. That's what we want to know. Cool. Everybody memorize the 4 rotator cuff muscles. Like every massage therapist talks about them all the time. All the time. Let's see. Miss Petrie. Something from today, Miss Petrie.
Quite a bit.
Quite a bit. Yeah. Feel a little overwhelmed?
No, not
Okay.
not as usual.
Good.
So that's-
Good. So the process is slowly working.
Yeah.
Yeah, it's supposed to. It's designed to.
Trying to keep the active practice.
Yeah. Anything, though, from today in particular that you want to just kind of remind yourself of and share with us?
Pectoralis major.
Thank you.
Pectoralis minor.
Yeah, and on the pectoralis minor, what ribs does it insert into?
That's a good question.
Rib number, let's see, Miss Petrie. What rib number?
3rd.
Oh, well, that's convenient that I use this hand signal for that. And
Right.
how many ribs does it attach to?
3.
Wow. So you mean when I do this, I can remember that there's 3 strands that attach to the 3rd rib, which must mean attached to the 4th and 5th, all with that little hand signal.
Right.
Almost like this guy's done this before. Yes, thank you, ma'am. Miss Hunter. Miss Hunter, what did you learn from today? Or what do you want to remember?
I did not know about delta being an upside down triangle.
Yeah! Yeah, it's from the Greek alphabet. You know?
Yeah.
That's why they have like Phi, Kappa, Delta stuff in college. Yeah, very good. And the deltoid is upside down. Cool. Miss Harper. Miss Harper. Something from today, Miss Harper.
I also want to, what Ms. Monreal said. I really like how you teach us, how you drill us,
You're making me very happy.
because like when I first encountered this muscle, when you teach us these muscles, it's kind of hard for me to observe it. But before, because you drill it to us every day, like now it's like, for me, it's kind of like I'm absorbing it a little
Yeah.
by little.
Yeah.
And sometimes like, oh,
Yeah.
yeah, I get it. So,
Good.
it makes me happy
Good.
that
I want you to be
I
happy.
get that.
Yes.
So I kind of like it.
Good. Thank you for. So two things. Remember, I don't believe in teaching. I believe in training. That's why I drill it every day. And the second thing is I've honestly had classes where I basically couldn't do this because people weren't able to laugh at themselves and let me kind of drill them over and over again. And every single person in here has let me come back to them over and over again and kind of kept good humor about it. And it can be very annoying, right? But you've all done that, and so it works. So thank you. It's a two-way street. Thank you, Miss Harper. I'm glad it's working for you. Miss Hanson. Something from today, Miss Hanson?
Can you just ask me a question?
Yes, I could just ask you a question, Miss Hanson. What are the 4 rotator cuff muscles?
The is it the deltoid? Or is it
The-
the
the-
infraspinatus?
Yeah, the 4 rotator cuff muscles sits.
Supraspinatus, infraspinatus, teres minor, and subscapularis.
Thank you, ma'am. Miss Yanez, something from today.
I forgot about the brachialis, so.
Yeah,
I
cool.
go back and make a flashback
Yeah.
for that. I completely missed that.
Well, you missed it because it's not in this section of the book. They put it in the forearm muscles, but I like to include it in this section of the book. It kind of makes more sense to me. But it bends the elbow, so they don't include it in this part of the book that's all about the glenohumeral joint and the scapulothoracic joint and stuff like that. Anyway, thank you. Mr. Kandaris,
Yes.
something from today, sir.
That the infraspinatus and teres minor have the same action.
Thank you, sir. What is that action?
Lateral rotation.
Thank you, sir. Miss Nguyen, last but not least, Miss Nguyen, something from today that you remember or want to remember.
New picture you talking about the lateral capsule.
Oh, levator scapula?
Yeah, pericapsular.
Yeah.
And when so I know about that. It's for new for me, and I can talk that.
Good. Levator scapula. I love it. Thank you. All right, everybody. So here's the deal really quick. I know class is over. The deal really quick is you do have a tiny homework assignment. Normally I would give you nothing because you'd have time to study, but tomorrow is an open book test. So you really can't, you don't need to study for it. I don't need you to study for it. It's just not that kind of thing. So you have another TED Talk that you'll get assigned, just like you did yesterday. I just want you to watch it, write something about it, and comment on whoever you got about it. You know what I mean? Comment on whoever you get assigned to comment on. And if you don't get assigned them in time, I'll work with you. But watch the video and make a comment on it for sure and try to do that. That's your only homework assignment. It hasn't been assigned yet. I've got to go do it right now, so you'll see it pop up in just a minute. And that's it. That's your only homework. And tomorrow you're going to come to class on time. Come to lab today on time. And tomorrow will be a wonderful day. A wonderful day. Did I lie? No homework. Yes, I lied. But I love you. And and it's fun homework and it's good. Yeah. And I'll see you guys tomorrow morning, 8 a.m. Yeah, cool. Thank you.
Yeah,
And-
but I want to ask you one more question.
You can
Before you-
You can ask me one more question. Go ahead.
Yeah, my homework is today late, but I checked all the
Oh, yeah.
that is too late.
No, it was late because I didn't count it late. The computer counted it late. And it did that, Miss Nguyen, because I had to tell the computer that the homework was done at 11 a.m. so it would start assigning partners. I had to make a cutoff period. And so I didn't take off points. You're going to get your full points. You're fine.
Yeah. Thank you, sir.
You're-
But I saw fee in the late. I'm worried about that.
I know. Yeah, I wrote you back. I will not take off points for it being late. It's not really late. I totally understand. Yeah.
Yeah. Thank you, sir.
Yes. No problem.
Bye, sir.
Bye-bye.
And the homework and the ISM open same yesterday, right?
Yes. Yes. You're going to open it the same way. Yes. You're going to go to discussions.
Yeah. Thank you, sir.
Thank you. Thank you. Are you staying on, Miss Stanley, to scold me for signing homework?
Partially, yes, and I was just making sure I could find it.
Okay, I just opened it up, so tell me if you can find it.
Okay. Is it The Secret to Living Longer?